Hello, everyone, and welcome to the fourth community table, How to Talk to Your Medical Provider. This discussion was moderated by Julia Blanchette and included perspectives from Kiyomi Knight, Dr. Jonathan T. Arena, Joy Ashby-Cornthwaite, and Keith Creer, all of whom either live with a form of diabetes, have expertise as a medical provider, or both. Community table conversations are monthly live discussions from Beyond Type 1 around often under-discussed topics pertaining to the entire diabetes community and featuring community members, experts, and healthcare providers. We want to thank those who make conversations at the community table possible. Community Table is presented by the JDRF-Beyond Type 1 Alliance and made possible with support from Abbott Diabetes Care, Dexcom, Lilly Diabetes, MannKind, Medtronic, Omnipod, Roche Diabetes Care, and Tandem. We hope you enjoy this conversation, and we'll see you all at the next community table.
And JT, you're up next.
Hi, everybody. My name is JT. I am a first-year resident doctor in Miami, Florida, doing my residency in ophthalmology at Bascom Palmer Eye Institute. I'm a Texas local from Marshall, Texas originally, went to Baylor, ran track for undergrad and grad school, and then out to California for medical school. And I was diagnosed at 13, a lot more similar to Kiyomi's, where I was kind of like losing weight for a long time. My family didn't know what was going on. I kept fasting out in football practice because I'm from country Texas and everyone plays football. And luckily that's what they told me to go try something easier like track. And I ended up running track in college. So that was a positive that came out of it.
Well, awesome. So we're actually going to get started in the discussion. So the first question I was going to ask is actually to think about when you were diagnosed, what your experience was like, and then what resources you were provided with. So Kiyomi and JT, you guys already went into that a little bit, but maybe if Keith wants to go into his diagnosis story, and then you guys can kind of talk about the resources you were given, that would be awesome.
I was diagnosed in 2017. How I found out was that I was at work, and this is when I was working at in the car business. I passed out at work, so didn't think nothing of it. But I woke up in the ER, and then they said, "Okay, well, you're dehydrated. You're working in the sun too long, but your sugar levels is at 300." And I was like, and they asked, "How long were you diabetic?" I said, "I'm not diabetic." And they were like, "Yes, you are." So we do some things to kind of help figure out what's going on. Went into that, saw my PCP. That's what they kind of explained to me. And they kind of give you what I call now this outdated pamphlet about diabetes, right? And nutrition. And they just handed it to me and said, "Read this over and we'll schedule the next appointment." And that's literally how it happened. For me being diagnosed, it was traumatic because now it was like, what do I do? When I saw my first nutritionist, it was the typical 45-minute speech of, you need to eat this, don't eat this, eat less of this, more of this, bam, 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 thank you, have a good day. And they sent me on my way. So
Joy and I are cringing right now hearing that.
yeah. It was not a happy experience for me because, again, I had to call my mom because she works in healthcare and ask her, and what she kind of connected the dots along the way. But my first experience with my PCP, which is no longer my PCP, was very, very traumatic.
Yeah, it sounds like it. So Kiyomi and Jonathan, or JT, why don't you kind of tell us like what resources you were given, if they were the same as Keith's, if they were different?
Yeah, absolutely. Again, from a pretty small town, my family was kind of right along the same lines where I was the sick drink that to like help you get better is always like Sprite or orange juice. So I was feeling sick and my parents were like, "Hey, you're thirsty, drink as much of these very sugary drinks as you want." We ended up going on a family trip to Guatemala and I was, throwing up a lot. I passed out a couple times and they were like, "Okay, we'll take you to the doctor." Went to my PCP. My family and a lot of people from where I'm from have a very rural mindset about seeing physicians. It's not usually healthcare maintenance. It's not usually routine. It's like, okay, I'm going to go to the doctor if I'm in real trouble. And to give you a context, I threw up all night, dry heaved a bunch, passed out 2 or 3 times that morning, and then I went to a half day of school before I went to my PCP later in the day. And he actually said he could smell the ketones on my breath and check my sugar, diagnosed me. At the time, he said, you got to go to the ED right now. My mom she's an occupational therapist, so she was crying a lot, and I think already kind of experiencing a little bit of self-blame, and she was beating herself up for not recognizing the symptoms. And at the time I felt, more responsibility for just making sure she was okay. And so I didn't even really process at the time what type 1 diabetes meant. I didn't know anyone who had it. My dad at the time he wasn't a diabetic, but he later became a type 2 diabetic. And I have a lot of people in my family who are type 2, but I had no idea what type 1 meant. And to be totally honest, I don't think he gave me any resources. I had no idea when I left the doctor's office that I was going to be needing insulin. I had no idea that I was going to need some medication for the rest of my life. Definitely hadn't had any dietary counseling. And unfortunately, again, there were no specialists where I lived, so I would have to drive an hour and a half away to see a peds endo, who was the only endocrinologist in the area. And he was phenomenal. He was great, but I didn't.
JT, what city did you grow up near? Like, what was the biggest city nearby?
The biggest city nearby is Shreveport, Louisiana, which is about 45 minutes from where I live.
Wow. Yeah, so you're in a really rural area.
Yeah.
Yeah. Wow. And Kiyomi, what about you?
Wow. All these stories are so powerful. I started wetting the bed, and I thought that my mom was playing a prank on me, and she threw water on me while I was sleeping. So when I woke up in the morning and I was, covered in liquid, I thought it was my mom. So I ran into her room and I was just like, it's not funny. Don't do stuff like that. And she's looking at me like I'm a psychopath. Like, what's wrong with you? Like, I didn't throw any water on you while you were sleeping, and, you're fine. And then it happened again. And this time I didn't say anything, and I had realized that I had wet the bed. It happened again. My mom had actually went on a trip to New York, and this was like right before Thanksgiving. It was the week of Thanksgiving. And I was using the restroom a lot. So I'm saying these things just so people know the signs and the symptoms and the clues. I was extremely thirsty to the point to where I couldn't quench the thirst. It didn't matter how much water I drank. It didn't matter how much juice, soda. It didn't matter how much food I ate. I was always constantly thirsty, and I was using the restroom probably about every couple of hours. And then it got to a point to where it was every hour. And then it got to a point to where it was like, no matter what I drank, it was just running through me within, 15-minute, 20-minute time frame. And this was going on for about 2 or 3 days. And I was just getting sicker and sicker. They took me to the emergency room. They diagnosed me with the flu, told me that I just had a common cold, to go home, drink as much fluids, to rest as much as I possibly can. So, like I said, my dad was buying me Jamba Juice. My grandma was buying me, gallons of orange juice. And, we were just trying to flush whatever it was out of my system. My grandfather is from the islands, and my grandmother is from Mississippi. So our medicine cabinet was the backyard. It was the fruits and the vegetables that were in the backyard. It was the herbs. It was the home remedies. It was the soups. And, they tried everything they possibly could, to help me get better, until, like I said, my uncle noticed some of the signs and the symptoms, and he was a type 1 diabetic, but had a kidney pancreas transplant. So he, at the time, was not a type 1 diabetic, but still understood, some of the signs and the symptoms. So when I actually went to the emergency room and they admitted me into the hospital, I was on the pediatric floor, and I was on an insulin drip. So I didn't have to go through ICU, which is the process as an adult. You go through ICU, you're on an insulin drip, and then you go into a regular room. But I honestly have to say, like, that was probably the first time that I felt safe after my diagnosis, was being in the hospital. So for me, it was getting me out of the hospital as a patient was what the medical team and my parents were working on, because I kept asking to stay longer, because I felt safer knowing that there was a diabetes educator there. There were other, people that were diagnosed with type 1 diabetes that were my age. And, the hospital was, for me, the hospital was my safe party space. And my roommate, she had a pancreas issue. So she was also in the same room as me. And the nurses would allow us to kind of sneak onto the 4th floor and use the service stairs. And I would carry her IV machine up the stairs, and she would help me carry her IV machine up the stairs, and we would have this opening of a window. So it was like the only place that we could get fresh air. You know, as a kid, you're diagnosed with type 1 diabetes and you don't really understand, you know, the severity or the gravity. I wish that I don't wish that I would have asked more questions. I wish that I would have understood the gravity of how diabetes was going to affect my whole entire life. And that was not something that you can kind of grasp at the age of 15. So after that is when I would say, I think it actually hit me after I left the hospital.
Wow, yeah, it's a really powerful story.
Like what resources usually provide, I think for kids and teens, it's really hard. Like it's hard to provide a resource to really have someone at that age grasp an understanding. I think that's something that you learn with time. But Joy, what do you usually give newly diagnosed people with diabetes for resources to support them?
Well, so first off, thank you all for sharing those stories, because I think as a clinician, it reminds us that we need to pause, right? So we should pause, check in with our patients who are newly diagnosed and their family members, and just take a moment to kind of, hear what you're thinking in your mind, what's happening. Are you scared? Are you frightened? Like, figure out what these emotions are and either let you hang in it for a moment or give you reassurance. I think it's really, really important. That's what I kept hearing. And I know that family members that are very near and dear to me, I know I wasn't there when they were diagnosed, but I know as a kid seeing their troubles, and I know that it stemmed from those same types of experiences. And I don't think as a person living with diabetes and getting that diagnosis at first, I feel very strongly against having you feel alone in that moment. It's just not a good place. And so, as a manager in our department, I work primarily with mothers living with diabetes during pregnancy. Some are diagnosed with gestational diabetes at the time, but some moms come into pregnancy having lived with diabetes. And I generally find out, we have so many resources at our command. We can take things out. And, it's my bag, my desk is kind of like Mary Poppins. It like just keeps going and going. And so my first question is always, how are you? What are you feeling? And what do you need from me in this moment right now? And so that's how I begin all my sessions. In training, they tell us we have to, there's a complete list of things that you have to teach people living with diabetes, and you toss that pretty quickly if you've ever lived with someone living with diabetes. And then you say, where are you and where should we start? So if today it's like nutrition, we'll start there. If it's, if it's today my eyes, then we'll call JT. So, wherever a person is and what they're feeling in that moment is where you have to go, because that's where they're going to be motivated to action, right? And so I think if your clinician hasn't had a moment to stop, don't, they might have a busy day. You never know what's going on. If my patient is like kind of going, and they're not stopping either, I think it's both people. You're part of a relationship. It's incumbent upon us to say, breathe, and then go from there.
Yeah, absolutely. And I love your approach. And I think everyone deserves a healthcare provider like you, Joy. I think it's really important to find someone who really supports you like that. Not someone who's just going to kind of give you information that's not relevant or helpful to you, right? So for the people who have diabetes, do you guys use diabetes technology?
Yes. Yes and no.
All of the technology possible.
Yeah.
Keith, do you use any technology?
No. Actually, I was trying to get the Dexcom, what is it, D6? But
yeah,
insurance company told me I couldn't have it because I was not a type 1 and I wasn't on insulin.
Really?
So yeah. Yeah.
Sad. So
So
Keith, do you want to tell us a little bit about that? Like, were you the one that brought that up with your healthcare provider? Did they bring it up to you? And like, if you brought it up, how did you kind of approach that?
So with my numerous changes of healthcare providers, I finally went to my diabetic specialist, and she kind of gave me some options and whatnot. And then when I found a new PCP, I asked about the Dexcom, and he told me, he was like, "No, you can't get it because you're not a type 1." And I was like, well, to me, it made sense to get because it helped me, maintain and keep and monitor my, my glucose levels without having to prick myself all the time. And he was like, no, you can only get it if you're on insulin. And I was like, well, I'm not on insulin, but I was on metformin. And he was like, no. So even when I called the insurance company, they told me the same thing. They were like, no, you can't get it because you're not type 1. You're not type 1. And so, I mean, so now I still walk around with the machine, and I still prick myself every day. So, it's a little, I'm not gonna say it's discouraging, but I do get tired of pricking my finger every day, you know. But yeah, so I look at all the new stuff that's out, and I'm like, okay, that's pretty cool. But I know it's geared more or less to type 1 or type 2 diabetics that are currently on insulin. And then what I've kind of found out, even with my research, is that most providers are bypassing the metformin and other medications and automatically putting people on insulin. So I don't know what that's about, but I did hear that from some other people that I've talked to here in Houston that are currently just found out they're diabetic, and they're like, well, they didn't offer me metformin, they didn't offer me Januvia, they just offered insulin. And I'm like, you probably want to get that checked out again, because sometimes, even with me, the metformin I was on 500 milligrams twice a day. And with just me changing my diet helped a whole lot. So my diabetic specialist, Lori, she was like, I'm glad you didn't get on the insulin because you would have literally bottomed out because your levels wasn't that high enough to justify injecting yourself with a third-party insulin.
Yeah. So it sounds like you might have found a specialist who advocates for you a little bit, right? I mean, yeah. I don't like that. I don't like that no one tried to help you get
Dexcom, I mean, it was crazy for me to my like to say the first, I would say like the first year and a half, it was like I didn't know what to do. I mean, I've heard, in the South we call it the sugars. So like, the old folks like, oh, you better stop eating that before you get the sugars. And that's all I knew it was. I never really knew what the dynamic of it was. So when I got diagnosed, it was like, okay, nobody told me that, the difference between a type 1 and a type 2. They just automatically talked to me as in a lump, and they grouped everybody together. So I didn't know the difference. I didn't know the consequences of taking some of the medications. I didn't know what to eat because, like I said, the nutritionist was like, talk to me as, just an overweight individual. It wasn't like, all right, yes, you're overweight, but you have type 2, so we have to approach this a little differently. It was, and the reason you have type 2 diabetes is because you're overweight. And the only people that have type 2 diabetes are overweight people. So it was like, okay, so I got depressed, and it was like that dark space to where it was like, okay, fine, I'm not eating nothing. And so when my mom saw me, I had lost so much weight the first time around, my mom was like, okay, something's wrong. I got to get you to see somebody. And that's when she introduced me to Miss Lori, who was my diabetic specialist at Kelsey. And that's when she literally took the time to sit down with me and say, this is what type 2 diabetes is. This is how you need to handle it. Here are some ways to handle it. And I'm going to tell you the ways to handle it because I am also a type 2 diabetic. So to me, that was a plus because she understood the struggle. So with that actually helped me get back on track because I didn't know that if you didn't eat, that was worse than eating the bad things. It was, what I'm saying? So it's like trying to balance that intake of food and how to eat a little bit more for energy and well-being versus eating for entertainment and fun, if you will. But having that type of person that understood what you were going through, because one, they went through it, but also because they're currently living through it as well.
Yeah, that definitely helps to connect with other people who you're working with, for sure. So it sounds like you asked some questions about Dexcom to your provider, may not have gotten the best answers, but Kiyomi and JT, what did you guys ask your providers before trying your technology? And was there anything that you wish that you could have asked that you didn't?
Yeah, I wish I had asked about the technology sooner. That's my big thing. I think I currently use Dexcom, and I do Dexcom G6. I use an Omnipod insulin pump system, but I use the loop closed loop artificial pancreas system, which has been an absolutely life-changing experience. I mean, it's phenomenal. My sleep was like probably the biggest change. I realized I never really realized how much I missed sleeping through a night without getting alarms from the Dexcom, and it felt like a punishment for trying to be well controlled a lot of times, because I set my ranges pretty narrow because I didn't want to be high or low, and then I would get woken up and then I wouldn't sleep, and then I'd be high the next day because I didn't sleep, and it's terrible. But yeah, I originally started the Dexcom first. That was my first experience with sort of like more recent diabetes technology when I was in college, because I was doing track and cross country, and so we were doing on a weekly basis. My peak mileage per week was like 110 miles a week, and so I was doing like 21, 22-mile long runs on Saturdays with no CGM, no phone, just like a bunch of snacks in my back pocket. And my endocrinologist, who I finally started seeing in college because I had access to someone, was like, "Oh, that's a terrible idea. Let's get you on something that can give you a little bit of information to go off while you're doing all this exercise." And then soon after that, I got into an Omnipod. And then when I got to Stanford, I met phenomenal endocrinologists who I'm still super good friends with, taught a class with, do a lot of projects with. Dr. Marina Bassina, if anyone's out there in the Palo Alto area and needs the best endocrinologist I've ever had, she's the best. I tried the loop system, and at first I used the old Medtronic pumps because at that time they hadn't fixed it up with the Omnipods yet. And then as soon as I got the Omnipods, I was like, this is my thing. I love this. But yeah, I wish I had done more research on my own. I think that was a big gap in my approach to diabetes. I think was just coming into an appointment and being only sort of a receptacle rather than like bringing my own ideas and things I was curious about to the table. And that sets you up for a weird dynamic with your provider, I think, because then they end up it's harder for them to approach you on the things that you need help with when you don't tell them what the things are. And like Joy was saying, I think it's really, really important for people, for providers specifically, to meet patients where they are and ask them what they need help with. And if you think there's something that they need help with, ask them if they think that they're there, and kind of approach it that way. Because if you don't, then it ends up becoming a performance for the patient, a stressful performance. And they feel like they have to come in and pretend like they have everything under control. I know this because I've been 100% there. And I was dreading, the visits to the endocrinologist. And when they meet you on your, like where you're coming from, and try to address the things that you feel you need help with, it grows the relationship, and there's so much trust there that it becomes a team effort to do better and to help you feel better, rather than you feel like you're disappointing them or you need to pretend like you're not disappointing them. I think it's really important. Yeah.
Awesome. Thanks for sharing. Kiyomi, how about you? So like, do you use, you said you use some technology, and then
I do. It wasn't always like that though. In the very early stages of my diagnosis, I think insulin pumps were kind of starting to make their way more to the surface in like the 2003-ish era. So from 2003 up until 2005, because I turned 18 in 2005. So I saw a pediatrician, and I still was seeing an endocrinology team through pediatrics. This is at Kaiser Permanente in San Jose, California. So that's where I grew up, by the way, in San Jose, California. So at the time, I was on my parents' insurance, double coverage. So I was living the life, not, having really any cares or any worries. But they told me that I did not qualify for an insulin pump because my blood sugars were not at a certain level of control. So of course, being told that as a teenager and seeing that there's this technology that could potentially make my life a lot better, make my diabetes a lot easier to manage. Back then, you actually had to be in a certain range in order for you to qualify for an insulin pump. So I just kind of let the ship sail on technology. And then at like 18, I was kind of in a space of just wanting to be accepted and wanting to be liked and wanting to be loved by my peers and, wanting to go party and wanting to go, just do what other people my age was doing. And at that age, group, it was more embarrassing, I guess, than it was a proud moment to have technology. I didn't want a machine or device connected to me because at that time frame, at that age anyway, I thought to myself, like, well, why would I want to be connected to a machine? Why would I want something to remind me of what I already, am living with and what I'm dealing with? I don't want to look at this machine every day and, see that it's a reminder of what my disease is. I could take a shot and act like I don't even have diabetes, So back then, my mentality about technology was different, but I was also not educated properly on technology and its benefits, as well as I was not ushered into being a candidate for the insulin pump. I didn't really feel like my medical team at that age group was really supportive and like, you can do this and we're going to get you here and we're going to get you there. So I was also dealing with depression at a very young age too. So that plays a major role in, how you monitor your blood sugars and, how much insulin you're taking as a kid, and, my mom, she tried, bless her heart, but she just couldn't get me, to be active or to participate with, camps and things of that nature. So it wasn't until I was later in my 20s and I moved to Washington State where I also dealt with the UW medical team, and they also were kind of saying the same thing: unless your blood sugar is at a certain level of control, we can't advocate for you to get an insulin pump. And at that time, I was starting to experience what we know as diabetes burnout, but I didn't know that there was a term. I didn't know that that's what I was experiencing. But I also didn't realize that from the age of diagnosis up until my late 20s, that I didn't have any support whatsoever. I didn't have anybody to talk to about diabetes. I didn't have, groups or camps or social media. Like my MySpace was used to just communicate with my friends, and then Facebook came about and I still wouldn't really talk about my condition. So I didn't have the best education up until 2016. Well, it was 2015. I was on one insurance plan, and that insurance plan was not covering insulin pumps. And they were asking you to kind of jump through hoops, like 6 months of blood sugar readings with explanations. And it was crazy, the criteria that they were laying out for me to have to meet in order to get an insulin pump. So the following year, I actually switched my insurance, which unfortunately I had to switch my medical team, which I loved. But I switched my medical team and I was able to finally get on the T-Slim, the Tandem T-Slim. And then Dexcom came later on. So I've actually only been on the Dexcom for about 2 years now. And I've been on the T-Slim now since 2016. But I do take routine breaks because I do get a little overwhelmed with my technology because, kind of like JT was kind of saying about like the alarms, you're trying to keep your blood sugars in a certain range, and you want to excel, you want to be really positive, but sometimes those alarms, the way that they're going off, can actually add more stress and turmoil to my life. So I take a lot of breaks from my insulin pump. I take a lot of breaks from my Dexcom, and I'll click my finger. But I was getting to a point where I had to check my blood sugar almost 10 times a day, and that got draining. So I needed technology for myself.
Absolutely.
I try to change the alarm sounds on my phone, Dexcom, frequently so that none of the sounds get like too triggering. You hear it enough times and you're like, oh, I don't know.
It makes you cringe a little bit.
It does.
It's a good tip. That's definitely a good tip. Hey, so I want to switch gears to insurance a little bit. So have you guys found that providers are helpful in helping you navigate insurance? And then like kind of talk about that? Like,
No.
So can I can I just say something really quick? So, and you guys are always, I'm always learning from the people that I help, from my patients, from their family members. And one of the things that you spoke to, Kiyomi, was that you you know, you maybe didn't understand technology, right? You didn't understand how it can help you. And I think it's really important, and Julia, you can chime in too with your patients, but I think it's really important for us as clinicians to connect the experiences of living with diabetes to the way that technology improves those experiences. So sometimes I think my patients are like, wait, are you like, can you tell the future? Like, why do you know this thing about me and what I'm doing? I'm like, well, I'm looking at your trends and this is what happens. And, the pump can do, if we like say someone is experiencing elevations like right after eating, right? And they were always on Novolog, and their insurance changed. And so they had to go on Humalog, right? So then we start talking about the reaction of that medication in your body. So if you were on Novolog and you were used to taking your meals and taking your Novolog at the same exact time, you have to adjust because of the difference of time of action, right? So then I can say, maybe this is a good time to bring up pump therapy again. We can always extend a bolus. We can, we can change basal levels leading into your meal times. And when you start talking about what's happening with your usual care and then how your technology can augment your usual care, what you've done is you've transitioned someone to see and experience technology as a shortcut to what they already know.
Yeah. I definitely use that tactic too. And I think I used to find it harder to sell pumps than CGM, but I think with like the CGM data, like in combination with pumps and then all of the hybrid closed loop technology and the hypo prevention technology, I found it much easier to actually explain and connect with patients on how it'll improve what they're currently doing. So I think that's really important. And the other thing I do is I always give them all of the options. And I say, insurance could be an issue and cost could be an issue, but let's think about the options. Let's think about what you want and what's best for your lifestyle and your needs right now and like what your preferences are. And then let's look into the insurance together. That's kind of the tactic that I use. And I don't know if you guys have had good experiences with providers helping with insurance. That's actually my research area because I think it doesn't happen. So like, has anyone ever helped you? Like if you weren't able to get something?
No. In my experience, in my whole first of all, I've lived in 6 different states and I've been on Medicaid in 4 different states. And I can tell you now that being self-reliant, being as proactive as possible, and also looking at different issues in death and what's below the surface. So like, we know that there's a difference between what's available to the public, so public data versus private data. That's more on the internal scope of it. I got a lot of my information and a lot of understanding by calling and advocating for myself. That was how I understood how Medicaid works. That was how I understood prior authorizations. That was how I learned how to, if need be, bypass a doctor and go above them. Because if I didn't do that, then I would be sitting around waiting for medications. I would have been sitting around waiting for technology. I would have been, kind of at a loss with, insulin and getting insulin. So I know that for myself, I had to be as self-reliant as possible and be proactive and just kind of ask those questions and call and constantly bug. And yes, it gets draining. Yes, you get tired of advocating for yourself, but you can
you have to get things done. Like, I hate to say it.
You can create a better change in your life if you just do it yourself sometimes. And that's my honest answer is I have not gotten any feedback from any provider that has helped me with anything that had to do with my insurance. It was all by way of me doing it for myself.
Y'all, you are making me want to like start a whole training session for clinicians right now. As like, I think I was in my internship for dietetics, just, after I completed my master's program, and I went home immediately and I started like advocating for my parents. Like my dad had a vial and it was like 2006. And I was like, you don't need a vial and a syringe. Like you work outside. This is nuts. Like this is this. And so we started looking. One of the things I have to say, in defense of clinicians, there is so much work to be done with care. And so what you need to do as a clinician is augment your team. You need to build your team. So coming into where I work right now, I was the first embedded diabetes educator. So I needed a job, and my husband was formerly military. So everywhere we went, the job may not be there. So I would just go and like, be like, you need an educator, don't you? And they were like, I think we do. I was like, you do, you should make a position. So like, I was like begging, they're like, well, are you an RN? I was like, no, but you do need an RD. You do need an RD. And nice. So they hired me here at this location, and going in, I kind of said, this is what needs to be done for people living with diabetes. This is what we need. And so fast forward to like 7 years later now, I've asked for, we will have 4 educators, and we will actually have a diabetes specific insurance verifier, because I am like literally like a guard dog. My patient comes in, they're like, I need a CGM. And I'm like, all right, let's go. What do we need? Are we going to do pharmacy benefits? Are we doing medical? Are we doing half and half? Have you met your deductible? Is there a copay card? Let's do this. And they're like, Joy, I don't know if it covers it. I was like, but if it does, we're going to make it. And so we'll just dive in. And if it takes us a month and a half to 2 months, we will jump through all of the hoops. They will get 5 copies of all of the paperwork that they're asking for, maybe 3 or 4, several different faxes in their companies. They like, honestly, are like, Joy, Miss Cornthwaite. Now, when the insurance company knows how to say Cornthwaite, like, they're like, they're done. Like, they were like, you just called yesterday. I was like, I just want to know the status of my prior authorization. This is the HCPCS code. This is the NDC that you need to use. I've called the pharmacist. My patient needs this yesterday. And they're like, all right, so will you call tomorrow? Yes, I will. So we'll have the prior auth for you like soon. Because this is life and death for people, It's your mental health and wellness. It's that of your family members. You need to sleep, JT, at some point. So, all of these things, it's so important that we help you get there so that you can live your best life. You can't live your best life if you cannot take care of yourself. Yeah. And so I'll stop, because you probably see how I get with the insurance companies. I'm like, woosah, I just need my stuff. Let's make it happen.
Yeah, and I think if you don't have a provider like Joy that like isn't really fighting for you with the insurance companies, ask who handles the insurance at your office. Sometimes it's like a case manager or a care coordinator, or it could even be some type of like medical secretary. Just like find out who does it and like try to build a relationship with them, because that can be helpful as well. If you don't have a Joy in your life. Sorry, I think I said Joyce, did not mean to do that.
My full name's Joyce Lynn. My family calls me Joyce. So
there you go. Okay. So I knocked that off. So we kind of have to start wrapping up a little bit. So I want to kind of end this with asking more about like your provider relationships. So if everyone could go around and just kind of say a little bit about a really helpful thing that a provider has shared with you, and then how you maintain a good relationship with that provider.
I'll go first.
All right. Thanks, Keith.
My PCP, dumped him. Endocrinologist, dumped him. I really didn't get any progress with living with diabetes until I met my diabetic specialist, point blank period. And it's because she's living through it. And then on top of that, she actually breaks everything down with her, to the point where I still send her pictures of me and my son because I was told that I couldn't have kids. And because, because of the diabetes. So she like gets ecstatic when I send her those pictures of me and my son. So she was like, I'm so happy you think about me and send this to me, because I'm like, and I tell her, like, it's because I had a better understanding going forward after my diagnosis that I was able to get to this point. So I share that with her every opportunity I can.
Awesome.
Absolutely. I think I've had the full spectrum of experiences from an experience I shared with you all, last week in our talk about, I had someone from the clinic of my endocrinologist in college who was not my endocrinologist, someone I'd never met before, say some really mean things to me in an effort to get me to change my habits in college. And I was definitely in the same place as kind of Kiyomi said earlier, where I was like, I didn't want to worry about diabetes. I wanted to be a normal kid. I wanted to have fun.
We've all been there.
And I was not in the place to hear that. Yeah, exactly. I wasn't in a place to hear that message at the time. And I definitely wasn't in a place to hear that message from someone I didn't even know. And that really hurt my relationship with that office. I kept going to see them, but I felt from that point on, it was just very much like I resent having to go, and it didn't feel like a constructive relationship. I met my endocrinologist in California, who I've already plugged. phenomenal doctor. I think I was really into mountaineering at the time, and I told her I was going to go climb Mount Whitney in California, and she was like, okay, what kind of glucometer do you have? Because one of them uses the peroxidase reaction, one of them uses an oxidase reaction that's dependent on the oxygen content in the atmosphere. So you got to have the right one if you're going to go up above certain levels of mountain. And I was like, wow, this is the best thing ever. This is the coolest thing ever. And she was the first person to really break things down with me. When she was looking at my data, she didn't just look at it and say, you're doing this wrong. She said, tell me what you think is going on here. It looks like maybe you're up early and you're in the hospital, you're not taking insulin before you eat breakfast. Is that what's happening? And then look, you go high and then you go low really hard. Are you rage bolusing after that? And then, she just really met me again, kind of exactly what Joy was saying earlier. She really met me where I was. And that was the best relationship I've had with any endocrinologist.
Yeah, and I think it's important to keep in mind that, like, if you don't have a provider who isn't meeting you where you are, unless you're in an area, we have to bring this up, but like, if you're in a rural area where there is no one else, I would try to take advantage of some telemedicine at this point
Absolutely.
where we are now. But otherwise, like, really change providers. Like that, when you're not feeling good, when you're feeling judged and you're feeling like you dread going to them, like, try to change providers if you have that option. Just wanted to put that plug out there. But Kiyomi, please share your experiences next.
So I think I shared a little bit about living in different states. So I've dealt with a lot of different doctors. I've also dealt with, of course, PCP, endocrinologists, and specialty doctors, because I was diagnosed with other chronic conditions as well. So I've had to talk with a lot of different types of doctors, and I've also had a lot of hospital stays. So for me, like I said, my experience has been more misdiagnosis or medical procedure error or some type of medical negligence or type of like medication errors in a hospital. And so dealing with a lot of different staff, I want to say I had a season where I was extremely bitter. And that's just me being completely honest. I grew bitter over time. But now I'm in a place of wanting to maintain healthy relationships all around in my life. And that's personal to professional. And I would say with any professional relationship with any provider or any medical team, because you're not just dealing with your doctor, you're dealing with your doctor's medical team that actually, makes the calls. And, if they drop the ball, then it falls back on your doctor. So I think listening is big. I think communication is key. I think communication shapes like identity and perception and things of that nature. And it helps build trust and establishes rapport and, demonstrates, if a doctor can demonstrate concern, I think that makes all the difference as well, about your concerns. And then I think it's important for doctors to also ask us specific questions and not us as patients always be the ones to ask the specific questions to our doctors. And verbal affirmations from a medical provider can go a really long way. You can do this, you've got this, I've got your back, those things can go such a long way. So those are my tips on, maintaining a healthy relationship with your provider or your provider's team.
Awesome. So, and I think we've all kind of talked about how we've had to switch providers, right? So how did that go? So when I personally have switched providers in the past, I had one bad appointment and I was like, on to the next, didn't even go back to that person. Did you guys just switch, or did you kind of like have to have a conversation with them?
Oh no, I just switched.
You switch, yeah. That's my approach too.
I wasn't wasting the time because once I got out of the depression stage and I knew, like, you know what, Keith, you got to take charge and you got to do things yourself. I just switched. I didn't say anything because at that point I felt like it was my life on the line that he didn't really care too much about. So it was like, let me find somebody else that's going to help and guide me through this process.
Yeah, and Keith, when you found a new provider, was there anything specific that you were looking for in that provider, or just someone who was better, like didn't treat you like
just
that?
Someone who had a listening ear, someone that was kind of understanding instead of looking at me as a spec sheet on the clipboard, because that's what was going on. It was like, oh, well, you're 6 foot, you're 360 pounds. This is why you have diabetes. I'm put you on this, this, and this. I wrote your prescription, send it to your pharmacy. Here you go, you're on your way. And it was like, I didn't even get a chance to ask questions. Like, I don't know what's going on. So once I said, you know what, and I did my research and I said, hey, you know what, it's on you, Keith. You have to figure this out. You got to go in strong-minded, asking questions. If you don't get that vibe at that moment, then you say, hey, thank you, and go find the next one. And then when my mom heard my frustration, she was like, let me introduce you to Lori over at Kelsey. She's going to help you, I promise. And when I took that appointment, which was meant for 45 minutes, we were in there 3 hours. And she broke everything down for me. And I was like, oh my God, you really made this so simple that I understand it. You didn't talk to me as if I was just another patient in rotation. And so from that point on, that's why me and her have a great relationship. I call her, hey, look, how do I do this? What do you suggest here and there? So, because when I said I was going more or less on a holistic route with eating, my endocrinologist was like, oh no, you need to be on this medication, da, 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 da. And I was like, well, I want to try something to kind of ease upon the medication because my kidneys are hurting. I got neuropathy. Like, I got all this stuff going on. So when I found that right person, it was great.
Yeah, it's good finding that right provider who you can stick with, for sure. And I think the other thing too is, if you bring something up with your provider and have the courage to do that, you don't want them to shoot it down. So I think finding a provider who does listen, who you can bring up different things you want to try or different concerns you have is so important. So I wanted to thank you guys for all sharing your insight. I think I'm going to have to toss it back to Jordan or Tiana right now.
Thank you so much, Julia. And yeah, thank you all so much for joining us tonight. This is an incredible group of individuals, and I think that's honestly an understatement. Really appreciate the candor and expertise, and and respect to you all so much for sharing with us and being so vulnerable. For all of you watching tonight, we have 8 more community tables coming your way, so you can only expect more awesome conversations like these. I mean, I hope the rest measure up, because this one was a really special one. But you can register for next month's now. We're going to be talking about mental health in honor of Mental Health Month in May. It's going to be a really, really important conversation, and it's one we don't think you're going to want to miss. So otherwise, please stay tuned. We're going to be resharing this conversation and resharing some content with some learnings, because there certainly were a lot tonight. Thank you again to this group. And we want to take the time, of course, to thank those once more who made this all possible. Community Table is presented by the JDRF-Beyond Type 1 Alliance and made possible by Abbott Diabetes Care, Dexcom, Lilly Diabetes, MannKind, Medtronic, Omnipod, Roche Diabetes Care, and Tandem.
see you all at the next community table. And thank you so much again to this group. You guys were amazing. Have a good night.
Thank you. Thank you for having me.